6 minutes goes fast, so I'll just launch in here. I'll talk about our non-union plan at Safeway because our non-union plan tends to be the precursor of what ultimately happens in the union plan. We basically have taken a page from the auto insurance industry. With auto insurance, if you're a safe driver, if you do not have moving violations, you pay less. If you have accidents, if you have moving violations, you pay more. And we essentially take the same approach. We think that about 70% of health costs are behavior related. So if you can alter the behavior, you get a better outcome, you get a healthier individual, and your health care costs are reduced. So we start with a base premium. And in October, during our open enrollment, you can participate if you want to. It's totally optional in a program we call Healthy Measures. And we measure 4 things: nicotine, blood pressure, cholesterol, and body mass index. And if those measurements are in an acceptable range, maybe 2 of them are, maybe all 4 of them, you have a deduction off your base premium. You pay less. So the employee, in a sense, kind of has skin in the game, if I can put it that way. If I was obese, it's okay. I can test in October. A year from now, I can test again. If my body mass index has reduced by what would be considered an acceptable amount, Safeway will refund to me the premiums that I have overpaid. So there's an incentive there. Another thing we did this October was we all took a University of Michigan survey about healthcare, and it took me about an hour to do it. Just for taking it, I had a $130 reduction of my healthcare costs for this year. And it gives me a printout on things that I can do in terms of sleep, exercise, diet, even how I drive, alcohol intake, things that I can do to be healthier. My total savings, because of this Healthy Measures program, the things that we can do, my total savings for me personally this year was just shy of $1,200. So you do have skin in the game financially. We have a health reimbursement account that we set every employee up with. We fund that. We put money into an account. If at the end of the year you have not spent all of that money in your health account, that money goes forward into next year. You don't lose that. So there's an incentive to be a good customer or consumer, if you will, of medical services. We provide free preventive care. So an annual physical, it's free. Colonoscopy on what most people would consider a regular basis, which I think is 10 years, that would be free. Preventive health care is free. There's a website that as a Safeway employee I can go to that provides me transparency on costs. And I can type in a zip code, and if I use colonoscopies as an example, it will tell me the price range for a given zip code for, say, a routine colonoscopy. We did this for a corporate office in Pleasanton, California. We discovered that within a 30-mile drive of Pleasanton, a routine colonoscopy ranged from a low of $700 to a high of $7,000. So we've given our employees an opportunity to be good consumers of healthcare, to become better educated, and they do use that website, and it has helped. We promote smoking cessation programs. We promote fitness competitions. Frankly, here in Spokane, we like being associated with Bloomsday for a number of reasons, but one is Bloomsday is about fitness, and we like that. So I guess just to conclude, it's a healthcare plan where there's a personal incentive financially to be healthy. In 2009, when we took a look at the rates of our employees for smoking and obesity, our rates were 70% of the national average. It's good for our employees, it's good for our company, and it reduces our costs. So from 2005 to 2009, our healthcare costs as a company for employees on this plan stayed flat. And it wasn't flat because we put more burden on the employee. It wasn't flat because we cut health care. Those all stayed the same. We simply have healthier employees. And if we're going to fix the healthcare problem in this country, we have to have people healthier. If we can't get that done, I don't think we're going to fix healthcare in America.
Well, thanks to all the panelists. I mean, those were excellent.